Did you know that if your baby was born now prematurely, there's a good chance he won't even need help breathing? This is definitely the best news of the week, but there's still more news about your baby. Some things I want to talk about: you and your body changes, nutrition tip and special tip for this week. You know what? Stay with me. I'll buy you. Hello, I'm Monica Romero. I'm so happy to have you here with me, especially with this good news out there. If the baby is born now, the chance that he will need a device to breathe is very small because his lungs are already maturing. They already have enough surfactant fluids so that he can expand to breathe and then contract at the time he is releasing air. But now it's my time to talk about you. Look, how's the belly? How is the uterus already there, but dropping all its organs, which can bring you heartburn, discomfort, a little difficulty breathing? We can no longer expand the lung that much. When it comes to breathing, breathing becomes shorter, which also makes us a little more panting. But this change in weight, right, in all this curvature in our spine, ends up bringing us a lot of back pain. It changed our posture, and it is a strength that we are also making. Extra, that often our body was not prepared for such a pronounced weight gain in so little. It's normal, yes, we feel back pain, and exercises can help you, but they're not just any exercises, okay? You have to do it with the help of a professional, but mainly the stretching and the positions that bring the most results. It's the kitten yoga position, which is the one I'm passing on to you, with which you push your belly down, but you're going to try to lift your back, right? Middle of the back up there. This help position and squat too. But if you have pain, bleeding, discomfort, no doing this alone, okay? And those who suffer most from back pain are mothers who have small children, who is holding a child on their lap, if it is your case, and the pain is preventing you from having a normal life. Time to talk to your doctor. Some medications can be offered to you there, right? Safely, for you to go to your little baby, and that will help you change to deal with it. But if we don't change our ways, that is, we continue to exert strength, right? Ambassadors in vain, holding a child in his lap. Oh, I went through that. It's difficult. But if we continue to maintain this lifestyle, the pain ends up coming back. It won't resolve. So there are two actions that we have to take. The first is to talk to the doctor, see if there is any medicine or an exercise to help. And the other is to try to improve at the end of pregnancy, which was hurting us. Avoid these efforts that are hurting our backs. Now around 2, right? At 33 weeks, we will feel more pelvic pain, which is a pain that we will feel there in the little beetle cap there on the forehead due to a ligament called the round ligament. And he's very stretched. If he was stretched before, he was already a little sore. Imagine now, right? We feel this pain more, and this pain ends up hindering us from walking, getting up, turning in bed at night. Oh, what an absurdity of pain. And what will relieve again are the stretches. And this pain tends to take over after childbirth, okay? I'm going to leave a link in which I explain pelvic pain better to you up here because I've already talked about it, right? In several weeks of pregnancy, I don't want to be so repetitive. And now I'm going to ask you to write to me here in the comments, and when you write, enjoy, and let me enjoy it here in the video. When I ask in the middle of the video, you remember more than when I leave it there at the end, right? So they let you enjoy it. As you write to me, you are feeling at the best of your life. Beautiful, wonderful, feminine, our mood up there due to pregnancy. And you knew that if you had felt that way, absolute minority of pregnant women, our society or even the media tells everyone that while a woman is pregnant, she is in her most dazzling phase. But that's what others see of us and not often how we see ourselves. You may not be feeling pretty, or you may be feeling too tired, a lot of weight, a lot of pain, and this doesn't let us enjoy this beautiful image that the media sells us. But it's a good thing that it comes from at least making us see this phase that we are going through in a good, more beautiful way, that while we are in it, it is really difficult. So I came to tell you that if you haven't felt all this glamour, it's normal. Yes, most pregnant women don't feel glamorous during pregnancy. They will feel when they look at the pregnancy album. He took a picture. Have you already hired a photographer to take a photo of you? Ask for a friend, for her husband. Take the opportunity to take a photo now. See? Then there is no more time with the belly. It gets too big, even scarce. I will leave a photo of me here. Oh, this photo I took 20 days before Lucas was born. It was my sister who took it for me. Look at the size of this gigantic belly. But if you want photos with belly a little smaller than you can even enjoy another album. It's time to speed up this project there, okay? But we will like our pregnancy much more after we go through it, that we remember the baby moving, we remember the good phases and forget the pain. Pains are in the past, and some of the discomforts you may be experiencing are temporary urinary incontinence. It is super common for us not to be able to hold our pee at this stage, especially if we have had another child and our pelvic floor is not so well exercised. It can happen, and we end up, as it is temporary, we end up getting rid of it as soon as the baby is born. But he coughed, sneezed, made a force, a little pee came out. Oh, how boring, huh? But calm down, you're in the home stretch. You'll get rid of it in a little while. The contractions are also more common, the Braxton Rich training contractions. But if they're painful, if they're radiating down your back or even your pelvis, take a look at this picture that I left here for you. If you are feeling that it is coming more from above rather than laterally, if it is more painful than uncomfortable, time to seek medical help, because our interest is still that your baby stays a little longer in the belly. It's not time for him to leave yet. It's not good. I'm giving birth now. It's a premature birth, and from 37 weeks, your baby is full term. That is, it's ready to come here. Remembering that all the images circulating here, you can also find there on my Instagram, okay? You don't need to print the video. It's not all there for you to save and print. And finally, I've come to ask you not to charge yourself so much and not to have so many expectations. Why? Because not everything is as we plan. For example, your partner's vacation, he was planning a month of vacation for after the baby's birth and will only get 5 days, or that wonderful motherhood door. You got a nice price. Negotiated the maternity souvenir you wanted so much, arrived ugly, badly made. It was too expensive. You couldn't buy it. So there are several things that happen that are beyond our control. And when we start to suffer because of them, we stop enjoying what is really under our control, which is taking care of our belly, taking care of our well-being, being happy and remembering everything, to all the mishaps that you're going through, right? Or you can come by now. They're not that important. The most important thing is that you have a healthy baby on your lap for you to take care of, for you to be a mother. Other things can make it difficult. They can get in the way a little. They can make you upset. But don't let them make you miss this important moment in your life, which is pregnancy, which is already in the final stretch, the preparation for delivery and the birth of your baby. Speaking of baby, let's talk about that big juicy pineapple that's in there. Your baby is already measuring approximately 32 centimeters from head to butt, considering the legs is already 44 centimeters and weighing 2 kilos, 2 bean bags, and about the size of a pineapple. All measurements and weights are approximate, okay? It's a little high. It's a little lower, or even a little higher difference. It's perfectly normal. Genetic actors, what you eat, where you live, all of this influences. Your amniotic fluid is at its peak. You have 1 L of amniotic fluid there, which is where your baby is immersed, and he is already losing the lango, which are those little hairs that cover the skin. He is already losing. It's been a few weeks, but some babies already lie more. Everything has fallen out and has already been taken over by little hair. In some cases, he already has eyebrows, eyelashes, nails that already exceed the finger. You'll have to cut them off after they're born. As I was talking about at the beginning of the video, your little lung is already producing surfactant liquid in better quality and quantity. It wasn't low quality before, was it? Not now. He's in a legal amount now, which means if there's a premature pact, there's a good chance he won't need to be on ventilators. He can breathe on his own. Is your little liver already starting to accumulate iron, getting ready for this side and your head? Your brain development continues to super accelerate in the production of neurons and synapses, which may mean an increase in head circumference of 1 centimeter this week. Remember that all this growth and development of your baby is reflecting on his weight and yours as well, which can mean that, hey, this week you gain about 300 to 500 G. And the latest news, which has everything to do with my feeding tip, is about your baby's bones. I've been saying for some time that he's getting firmer and firmer, but he's firm doesn't mean he's all stiff. It still has some flexibility, mainly to help with normal childbirth. Here, oh, in the baby's head. There are several people who are afraid of molehill, but molehill is extremely important, not only to facilitate normal birth, but also to allow the baby's brain to continue to grow, continues to develop, and it will stay wet until approximately 1 year of age, which is when it will merge with the other bones of the skull. As I said, in Bones Nutrition Tips, we will talk again about calcium. How's your diet? Are you getting enough calcium? Is it? We find calcium mainly in milks and derivatives, and we will also find it in chickpeas, sesame, parsley, in these foods that are showing on the screen for you. And remember that your baby won't miss it, okay? Your body will take it out of you to pass it on to your baby, but can it cause osteoporosis in mom? So let's take care of calcium intake. And my tip of the week is about a subject that I covered in this video. Maternity Souvenir Maternity Door. Are you interested in these products? If you have, it's time to start researching and already close your contracts. By this week, you have timely until the birth of the baby, but there are some things we need to observe. First, about smells. If you want to give a maternity souvenir that has smells, it is very important that they are very well sealed, because there can be nothing smelly inside the baby's room, including those flowers that like to give mothers, and I love with passion. They don't stay inside the room. They will stay at the door of the maternity ward, at his door in your room, because it can have neither pollen nor the smell of flowers and can cause allergies to the baby. So if you win, be very happy. It's delicious. Take it home. But even when you take it home, do not leave the flowers in the environment that your baby will be in because of the smell and pollen that can cause allergy. That said, about smells, we will now talk about those that are perishable. A maternity souvenir is something that has a short shelf life, such as the wonderful, delicious, well-born ones that I love with passion. And if you're ordering, I'll order one for myself. I love it. They're wonderful. But when you're closing with someone, the likely due date is just a guide to when the baby might be born. Only 10% of babies are born on this date. The other 90% will be born on different days. So we have to look for a company that can serve you. So when you go into labor, you have to have the person's phone number there. Who will make this souvenir for you to place the order? And usually they can deliver you in 24 hours, but negotiate well so you don't have a problem. And if you can't get that flexibility, maybe think of a little chocolate, a candy, something that has a slightly longer shelf life that you can program yourself better and not depend on that last hour. Remembering that you can be born on Saturday, Sunday, holiday, Christmas, New Year's Eve. There are several dates that many people need to be willing to work to be able to serve you. I really hope you enjoyed these tips. If you liked it, don't forget to leave a like for me. I'll see you in the next video.